Critical considerations regarding relocation to a nursing facility. Have you considered the realities of life in a nursing home? While you may envision a peaceful existence with attentive care and freedom from financial worries, the truth can be starkly different. My decision to enter a nursing home, initially perceived as sound, quickly revealed itself to be a grave error. This video will expose 6 harsh truths about nursing home life that are rarely discussed. If you or a loved one are contemplating this significant decision, viewing this video is crucial to avoid future regrets. 1. The experience of being overlooked. Psychological factors. Loneliness and diminished social connection. Neglect manifests not merely as a lack of visits, but as a profound loss of connection with society, family, and loved ones. While initial contact was maintained, unanswered expectations fostered hesitation, fueled by a fear of becoming a burden. Consequently, the acceptance of diminished familial attention resulted in feelings of disappointment, despondency, and even depression. Sociological factors. Modern lifestyles and shifting priorities. In contemporary society, descendants often prioritize demanding careers, education, and personal relationships, resulting in limited time dedicated to the elderly. While initial concern may be evident, the pressures of modern life lead to infrequent visits, reduced contact to brief calls, or even broken promises. This is a prevalent issue. The sense of isolation experienced by the author is mirrored by many other elderly residents within the nursing home. The impact of social isolation on quality of life is significant. Psychologically, older adults experience feelings of uselessness, abandonment, and a loss of life purpose, potentially leading to mental decline and a decreased motivation to maintain health and participate in social activities. Physiologically, numerous studies demonstrate a correlation between loneliness and increased risks of heart disease, stroke, cognitive impairment, and mental health issues such as depression. Furthermore, the lack of social interaction contributes to a decline in communication skills, memory loss, and diminished self-confidence in social situations among the elderly. For those considering placing parents in assisted living facilities, maintaining consistent contact is crucial. Regular visits and calls are essential to ensure they feel valued and connected. Whenever possible, prioritize maintaining elderly parents' independence at home with family support or home care services, rather than relying solely on institutional care. If institutional care is unavoidable, establish a proactive plan to preserve family connections through scheduled visits, video calls, and regular correspondence. Crucial questions to consider before entering a nursing home. Am I prepared to confront potential loneliness? Is my family truly capable of committing the necessary time and effort to maintain consistent contact? Are there viable alternatives that would allow me to receive the required care without separating from my family? 2. The loss of independence. Independence is crucial for human well-being. It signifies not merely the ability to perform daily tasks autonomously, but also the profound sense of self-control and agency over one's life. The loss of independence in elderly individuals precipitates significant negative consequences, including diminished self-worth stemming from reliance on others for even the most basic needs, diminished self-respect arising from feelings of burdening others, and a profound sense of disempowerment resulting from the loss of autonomy and control over one's choices and actions. The transition to a nursing home necessitates a significant relinquishment of personal autonomy, impacting various facets of daily life. Firstly, residents experience a loss of control over their personal schedules. Unlike the freedom to dictate their own wake-up times, meal schedules, and leisure activities at home, nursing home life operates on a rigid timetable. Predetermined meal times, sleep schedules, and structured activities eliminate the flexibility to align daily routines with individual preferences and rhythms, thereby undermining personal agency. Secondly, the ability to make independent choices regarding personal activities is severely curtailed. The autonomy to select preferred meals, prepare food independently, or engage in grocery shopping is replaced by a standardized, often unappealing menu with limited options. The inability to cater to individual dietary needs or preferences contributes to a sense of powerlessness and frustration. Thirdly, reliance on others for personal care becomes a stark reality. Tasks such as bathing, dressing, and managing personal hygiene, once performed independently, now often require assistance from nursing staff. This dependence can lead to feelings of vulnerability, loss of dignity, and a diminished sense of self-reliance, impacting self-esteem and overall well-being. Fourthly, the loss of control over one's personal space is a significant factor. The ability to personalize one's living environment through decor, cherished possessions, and personal arrangements is replaced by standardized, often impersonal accommodations. Restrictions on the amount of personal belongings allowed and the inability to customize the living space further contribute to a sense of displacement and loss of identity. Finally, social interaction and freedom of movement are significantly restricted. The spontaneous visits with friends, participation in community activities, and independent outings that characterize life at home are replaced by a system requiring permission and scheduling for external engagements. This limitation on social interaction and mobility contributes to feelings of isolation and confinement, impacting mental and emotional well-being. The cumulative effect of these limitations on personal autonomy can have profound consequences for the resident's overall quality of life. The loss of independence significantly impacts mental well-being, resulting in several negative psychological consequences. These include feelings of helplessness and sadness stemming from a lack of autonomy. Furthermore, diminished self-esteem and morale arise from dependence on others for personal care, fostering feelings of burden and decreased self-confidence. Finally, the resulting sense of loss of control increases the risk of depression, social withdrawal, and isolation. Minimizing the loss of independence in assisted living facilities. While assisted living presents inherent limitations, residents can maintain a degree of autonomy through several strategies. Select facilities offering flexible programs. Prioritize facilities allowing personalized schedules, dietary choices, and participation in preferred activities. Maintain personal routines. Encourage the continuation of hobbies such as reading, writing, playing music, or gardening to foster a sense of control. Facilitate family connections. Regular phone calls and video conferencing with family and friends are crucial for maintaining social engagement. Promote physical activity. Encourage light exercise and ambulation as appropriate to enhance both physical and mental well-being. Empower decision-making. Even with limitations, residents should retain control over personal choices, including clothing selection, meal preferences within reason, and activity participation. Crucial questions to consider before entering a nursing home. Am I prepared to relinquish personal autonomy for a communal schedule? Can I maintain individual hobbies within the nursing home environment? Will the facility accommodate my preferred activities? What provisions are in place to ensure a degree of personal independence? 3. The loss of life's purpose. What is the meaning of life? For humans, the meaning of life can stem from various factors, including family, providing and receiving care, witnessing the growth of children and grandchildren. Career, working, contributing, earning a living, and personal development. Hobbies and passions, pursuing personal interests such as art, sports, or research. Social contribution, assisting others, engaging in philanthropy, and participating in community activities. And social connection, maintaining friendships and relationships for companionship and shared experiences. Upon entering a nursing home, many of these factors are significantly diminished or lost, leading to feelings of emptiness and a loss of purpose and factors, contributing to a loss of life. Purpose in nursing homes. Diminished family role. At home, the elderly often serve as vital emotional anchors, advisors, caregivers, and household managers. Nursing home residency removes these crucial roles, leading to feelings of redundancy and uselessness. Absence of purpose. While retirement offers respite, continued purpose is essential for well-being. The repetitive and often monotonous routines of nursing homes frequently lack the stimulation and motivation necessary to maintain a sense of purpose. Social isolation. Prior to institutionalization, individuals maintain social connections through friendships, colleagues, and neighbors. Nursing homes often isolate residents from these networks, limiting opportunities for meaningful engagement and fostering feelings of loneliness. Loss of autonomy. Independent living allows for personal choice and control over one's life. The structured environment of a nursing home restricts autonomy, leading to feelings of powerlessness and a diminished sense of purpose. Deteriorating health and motivation. Age-related health issues can significantly impact an individual's ability to pursue passions and interests. Chronic pain, illness, and cognitive decline contribute to feelings of helplessness and negatively impact their outlook on life. The profound impact of a perceived lack of life purpose can manifest in several serious consequences. These include significant depressive symptoms and mental decline, characterized by pervasive sadness, anhedonia, and social withdrawal. Furthermore, a diminished sense of purpose frequently correlates with a decline in physical health, stemming from reduced physical activity and poor dietary habits, thereby increasing the risk of various illnesses. Finally, substantial research indicates a strong correlation between a perceived lack of life meaning and a decreased lifespan, attributable to the compounding effects of mental and physical deterioration. Strategies for enhancing the quality of life for the elderly in nursing homes. While nursing home environments present inherent limitations, proactive measures can significantly improve the quality of life for residents, fostering a sense of purpose and fulfillment. These strategies encompass several key areas: cultivating new roles and responsibilities. Actively engaging elderly residents in meaningful activities can revitalize their sense of purpose. Opportunities should be provided for them to mentor others, share their life experiences through storytelling or formal presentations, or contribute their skills in educational settings. Nursing homes should actively facilitate intergenerational programs, enabling residents to impart wisdom and knowledge to younger generations. Facilitating the pursuit of personal interests, maintaining and nurturing individual hobbies and passions is crucial for emotional well-being. Residents should be encouraged and supported in pursuing their interests, whether it involves creative writing, musical expression, artistic endeavors, or horticultural activities. The provision of appropriate resources and dedicated spaces is essential to facilitate these pursuits. Strengthening family connections. Regular and consistent contact with family members is paramount in combating feelings of isolation and loneliness. Scheduled visits, frequent phone calls, and video conferencing should be encouraged to maintain strong familial bonds. Involving residents in family events, even remotely, reinforces their sense of belonging and inclusion within their family unit. Promoting social engagement within the nursing home. Active participation in social activities within the nursing home environment is vital for combating social isolation. Nursing homes should offer a diverse range of social clubs, recreational programs, and competitive activities such as games, singing groups, and other social gatherings. These activities provide opportunities for interaction, fostering a sense of community and shared experience. Establishing meaningful personal goals. Retirement and the cessation of traditional roles do not necessitate a decline in personal ambition. Encouraging residents to set achievable personal goals, such as daily reading, learning a new skill, or writing a memoir, provides a sense of purpose and direction. These goals contribute to a proactive and fulfilling lifestyle, fostering a sense of continued growth and accomplishment. The establishment of these goals should be a collaborative process, tailored to the individual's capabilities and interests. 4. Health deterioration is exceeding projected timelines. Rapid health decline in nursing homes stems from multiple contributing factors. These include physical inactivity. Reduced mobility due to limited space and a passive care environment leads to muscle weakness, joint stiffness, increased risk of osteoporosis and falls, and a heightened risk of cardiovascular disease, diabetes, obesity, and other chronic illnesses. Home-based activities such as walking, gardening, and childcare contribute significantly to physical fitness and flexibility, which are absent in many nursing home settings. Inappropriate nutrition. Standardized meal plans may not cater to individual dietary needs and preferences, potentially resulting in nutritional deficiencies. This is exacerbated by the lack of dietary adjustments for individuals with specific health conditions, such as diabetes or hypertension, and difficulties with chewing or swallowing. Negative psychological impact. Feelings of loneliness, depression, and neglect negatively impact mental well-being, subsequently affecting physical health. A perceived lack of purpose and the belief that the nursing home is a place to await death can lead to a decline in motivation and overall health. Chronic stress and sadness manifest in sleep disturbances, fatigue, digestive issues, and hypertension. Insufficient personalized care. Staff limitations often result in generalized care, neglecting individual needs. Inadequate physical therapy support further diminishes mobility, while insufficient medication monitoring increases the risk of adverse effects and dangerous drug interactions. Increased infection risk. The congregate setting of nursing homes increases the risk of infectious diseases, particularly among residents with weakened immune systems. Untreated infections like influenza, pneumonia, and urinary tract infections can rapidly worsen health conditions. Rapid health decline indicators in the elderly. Observe these warning signs of accelerated health deterioration in nursing home residents. Significant physical weakness manifesting as increased difficulty with ambulation, pronounced fatigue, and rapid exhaustion. Unexplained weight loss, potentially attributable to anorexia, inadequate nutrition, or undiagnosed illness. Chronic insomnia resulting in cognitive impairment, reduced concentration, and irritability. Increased susceptibility to minor illnesses reflecting a weakened immune system and heightened vulnerability to infections and common colds. Diminished communication skills characterized by reduced verbal interaction and loss of interest in social engagement. Exacerbation of pre-existing chronic conditions, or the onset of new chronic illnesses such as uncontrolled diabetes, hypertension, or severe arthritis. Strategies to mitigate rapid health decline in nursing homes. Enhanced physical activity. Encourage daily ambulation and light exercise to maintain physical fitness. Incorporate yoga, meditation, or physiotherapy to improve flexibility and alleviate pain. Organize activities such as dancing, board games, and gardening to promote gentle, enjoyable movement. Improve nutrition. Ensure adequate nutrient intake, particularly protein, calcium, and vitamin D, to preserve muscle and bone health. Tailor diets to individual needs, especially those with conditions like diabetes or hypertension. Monitor dietary intake to prevent malnutrition and dehydration. Mental wellness. Regular family visits or calls are crucial to foster a sense of belonging. Encourage social engagement and interaction. Cultivate a positive living environment that provides purpose and strengthens the will to combat age-related challenges. Elevated quality of medical care. Closely monitor health status, promptly identifying and treating illnesses. Ensure proper medication administration, preventing misuse or missed doses. Implement regular health screenings to detect underlying conditions. Reduced infection risk. Maintain personal hygiene and a clean living environment. Administer influenza, pneumonia, and COVID-19 vaccinations to minimize infectious disease risk. Ensure adequate hydration to prevent dehydration and weakness. 5. Leaving the nursing home proved more challenging than anticipated. Several factors contribute to the difficulty elderly individuals experience when leaving nursing homes. These include deteriorating health and loss of self-care capabilities. Nursing home residents often experience reduced physical activity, leading to rapid health decline. While some may initially maintain independence in daily living, prolonged residence often results in dependence on medical staff, rendering them incapable of self-care upon departure. Without family support, independent living becomes impossible. Dependence on care services. Nursing homes provide comprehensive support encompassing nutrition, personal hygiene, medical care, and recreation. Accustomed to this level of service, residents struggle to manage independently. Individuals with chronic conditions, diabetes, cardiovascular disease, arthritis require ongoing medical monitoring, fearing the lack of professional care outside the facility. Insufficient family support. Families may initially view nursing home placement as temporary, yet later find themselves unwilling or unable to facilitate a return home due to work commitments, lack of caregivers, or financial constraints. Sometimes families become accustomed to the absence of direct caregiving responsibilities, perceiving the return of the elderly individual as an added burden. Financial barriers. Nursing home costs are substantial. Some residents deplete their savings or sell their homes to cover expenses, leaving them financially unprepared for independent living. Departure necessitates securing housing, food, and healthcare without a stable income stream. Some facilities impose long-term contracts or significant withdrawal fees. Acceptance of the status quo and fear of change. Some residents, despite initial reluctance, adapt to nursing home life. The familiar and secure environment discourages risk-taking. Isolation diminishes adaptability, fostering apprehension about the uncertainties of life outside the facility. Legal and administrative regulations. Strict nursing home regulations may require family or local authority approval before discharge. Lack of legal guardianship or a clear post-discharge living plan may impede release. Individuals deemed legally incapacitated due to age or illness require legal guardian consent for departure. Case Study 1. Elderly residents denied discharge against their will. Miss A, 78, entered a nursing home under the pretense of temporary care. After 2 years, she expressed a desire to return home, a request denied by her children who, having adapted to their newfound freedom, refused to resume caregiving responsibilities. Miss A experiences feelings of abandonment, yet lacks the financial resources and independent living options to leave the facility. Case Study 2. Inability to sustain independent living. Mr. B, 82, initially planned to leave the nursing home and return to his former residence. However, a recent serious illness revealed his inability to manage essential daily tasks such as grocery shopping, meal preparation, and housekeeping. Consequently, despite his desire for discharge, he remains in the facility to ensure his safety and well-being. Case Study 3. Nursing home obstruction of discharge. Certain nursing homes employ coercive practices to retain residents, including imposing burdensome discharge procedures and even issuing threats regarding the risks of leaving. Excessive termination fees further impede residents' ability to exercise their right to discharge. Solutions for facilitating the departure of elderly individuals from nursing homes. Pre-admission planning. Prior to nursing home admission, a comprehensive plan addressing length of stay, finances, and departure contingencies is crucial. Clear agreements with family regarding future plans must be established to prevent abandonment or homelessness. Strengthening family connections. Regular visits and consistent communication from family are essential to prevent feelings of isolation. If planning to bring a loved one home, suitable living arrangements must be prepared to ensure a comfortable transition. Securing adequate finances for departure. Avoid depleting all assets on nursing home fees. Retain sufficient funds for contingency planning. Explore available financial assistance programs for seniors, such as health insurance and Social Security benefits. Preparing for the transition. Individuals intending to leave should proactively rebuild self-care skills, maintain physical and mental well-being, and cultivate external social connections to mitigate isolation post-departure. Reviewing nursing home regulations before admission. Thoroughly review the contract, paying close attention to departure clauses. Avoid long-term financial agreements lacking flexible exit options. 6. The violation of privacy and dignity is unacceptable. Loss of privacy in nursing homes, shared living spaces, and lack of personal privacy. Most nursing homes offer shared or single rooms, yet constant surveillance pervades. Residents lack a sense of personal space. Their activities are monitored by staff or roommates. They forfeit the freedom to close a door, engage in private conversations, or pursue personal activities without observation. Continuous monitoring and loss of personal control. To ensure resident safety, caregivers frequently, and sometimes unexpectedly, enter rooms without prior notice. Some facilities utilize 24/7 camera surveillance, eliminating any sense of privacy. Individuals with cognitive impairments, such as dementia or Alzheimer's disease, experience even stricter monitoring and are often prevented from independent outings. Diminished autonomy in personal activities. Nursing homes impose structured daily routines, meal times, sleep schedules, bathing, recreational activities, restricting residents' autonomy. They must adhere to collective rules, unable to freely choose meal times, sleep schedules, or waking hours as they did at home. Some facilities even restrict phone and computer use or communication with loved ones for non-compliance. Difficulty maintaining personal confidentiality. In nursing homes, health information, financial matters, and personal relationships are easily disclosed as caregivers, and other residents may access personal details. Individuals requiring frequent assistance with personal care, dressing, bathing, hygiene, experience a complete loss of privacy. Loss of dignity in the elderly, a multifaceted issue. Dependence on others for basic needs. A significant source of distress for many elderly individuals is the loss of self-sufficiency, necessitating reliance on others for essential tasks such as toileting, bathing, dressing, eating, and mobility. This dependence undermines self-esteem, creating a sense of helplessness and infantilization. Treatment by staff and peers. Not all nursing home staff treat the elderly with respect and compassion. Some exhibit impatience, coldness, or even verbal abuse, yelling, humiliation, ignoring needs. Discriminatory practices may exist, favoring financially well-off residents over those with limited resources. Individuals with cognitive impairments, Alzheimer's disease, dementia, are particularly vulnerable to disrespectful treatment. The burden of dependency. The inability to care for oneself often leads to feelings of being a burden on caregivers and society. Some elderly individuals are treated as patients rather than valued human beings with inherent dignity. Restricted freedom, constant supervision, and dependence contribute to feelings of worthlessness. Loss of bodily control and associated shame. Loss of bowel and bladder control, requiring adult diapers, is profoundly distressing for many elderly individuals. Those who previously held positions of authority or enjoyed successful careers may experience a profound sense of vulnerability and uselessness. The need for assistance with personal hygiene further exacerbates feelings of shame and diminished self-worth. Neglect and disregard for opinions. In many nursing homes, the elderly have little say in decisions affecting their lives. Their input is not sought in activity planning or care decisions. This sense of neglect and unheard voices contributes to feelings of diminished self-worth and loss of dignity. The psychological consequences of losing privacy and dignity are significant for the elderly. Deprivation in these areas frequently results in negative mental health states, including depression, characterized by feelings of worthlessness and a lack of purpose. Anxiety and insecurity, manifesting as a constant feeling of being monitored and a loss of personal control. Anger and resentment, potentially leading to irritability and increased conflict due to feelings of disrespect and social withdrawal and a decline in motivation, ultimately resulting in apathy and disengagement from life. After my experiences, I offer this crucial advice. Carefully consider your decision before entering a nursing home. Contrary to popular belief, it is not always idyllic. More importantly, I invite your input. Have you considered residing in a nursing home? Has a loved one had such an experience? Please share your perspective and experiences in the comments below. If you found this video insightful, please like, subscribe, and enable notifications for future updates. I have much more to share regarding often unacknowledged realities of life. Thank you for watching, and I look forward to our next discussion.